If you take it down, though, to the level of us, at the personal level, at the family level, what am I hearing about how infections are occurring? Okay, and I hear a lot because I get a lot of emails and people ask me a lot of questions and I get a lot of data. So here's a very typical one. We rented a beach house for a week down here at the beaches in North Carolina. We drove down there, and my sister drove down from Pennsylvania, and my uncle drove down from West Virginia, and my nieces and nephews were there, and we all got together and had a real nice family vacation at the beach. And then we got home, and then 2 days later we get a call from my niece saying, hey, I got sick yesterday and I just tested positive, which means that all of you, because you were within that 48-hour period before that person got symptomatic, have been exposed. And then there's some cases that arise out of that in that family cluster. Extremely typical story. Another one is that my sister got married. It was a small gathering, but there were 20 of us, family and friends, and we had a really nice reception afterwards. The reception was maybe in a church community hall, people together. Were you wearing masks? Oh, not so much, no. But the next day, bridesmaid, test positive. And now you have a whole church group, a whole wedding group that's been exposed. So. And you can use your imagination a little bit. It's where people get grouped together. So there's been church outbreaks, and some with funerals, but it's where people get together in these settings. So there are small numbers where people say, hey, I don't know where I got it, but the majority of people can kind of link it to something. And so when you think about it, okay, those are the areas where you need to be careful. So I'm not saying don't get together at the beach with your family, but keep the gathering small. Maybe you could leave the uncle out this year and just Zoom with him a couple times on the laptop. So keep the gathering small, and then even though it feels really weird and odd, personally distance and wear masks when you're hanging out, after dinner, watching Netflix together, and things like that. Masks work. There's more and more data on that. One published by one of my former fellows this week by the CDC's MMWR publication, and that was the one about the two people cutting hair for 2 days, who both were symptomatic, both had COVID, and cutting hair, you're close to that person. No one got infected because they were wearing masks. So masks work, so let's use them. A little bit about travel, international travel. You want to do international travel? I got a message the other day on one of my listservs because I'm a travel medicine doc too. So there are 20 countries in the world who will take U.S. citizens right now. 20 out of the 150 countries in the world or something. That's not a lot. Most of those will require you to quarantine for 14 days if you go there. And some of them will require a negative test within 72 hours before going in their country. Good luck getting a test within 72 hours now because of the turnaround time. There are some countries that have no restrictions at all. One of them I found is Albania. So if you're looking for a nice, international vacation, try Albania. It might be a little bit austere, but a lot of people would have to even look it up to see where it is. I guess the tongue-in-cheek bottom line in this is international travel right now is very hard. If you have to do it, you can, but you might want to get in contact with the consulates and embassies to find out exactly what you need to do. And finding flights isn't easy either. Domestic travel is a little bit easier. My own personal experience flying back and forth to the Great Plains in the last week. Masking is happening. The airlines are being pretty strict about it. They'll toss you off the plane if you're not doing it. You can bring the mask down to eat or drink. Some people are trying to get around wearing a mask by having a very long drink or by eating things like sunflower seeds one by one over 2 hours, which is gaming the system a little bit. But for the most part, I think everyone is masking, and the planes are filling up some. I think they're trying the best they can to make them safe. And as we talked about 2 weeks ago, actually, there's very few published examples of airplane transmission, 3 so far. And there's a lot of published examples where transmission did not occur on airplanes from people who are symptomatic. So the airplane may be a little bit safer than you think. But you have to make sure you wear your mask, and particularly in the airport, personally distance. Should you avoid hot spots in your travel? Florida, Arizona, Texas, Georgia, California. I've said many times, and I'll just say it again, I don't think it's as much about where you're going as what you do when you go there. So even if you're going to a hot spot, got a friend going to Florida next week, they're going to visit their parents, do takeout, maybe go one day to a less crowded beach, stay out of the clubs, stay out of the restaurants, and hang out with their parents. And that's okay, I think. But higher risk behaviors, even in places that aren't a hot spot, are things that should be avoided. And we've talked about that before. Well, what about kids and coronavirus? A lot of people talking about this right now. And children do get coronavirus, and we've talked about the multi-system inflammatory dysfunction syndrome, which remains rare, by the way, in children, but serious when they get it. But very, I would say even very rare. The kids, when they get it, it depends a little bit how old they are and how they respond. And it kind of makes sense. Younger kids don't really get symptomatic and don't get sick. And if they get it, their viral load, how much virus they have in their airways, is lower. And so they're probably less infectious. We're still working out exactly how much less infectious the younger kids are, but we do know for sure they're less likely to get it. They are less likely to get sick if they do, and we think they're less infectious because of their viral load. As the kids get older, then they become more like adults in many ways, and so high school kids probably a little different, more likely to get symptomatic, more likely to be infectious if they do get it. The big news, I guess, this week, late last week, is school systems in our area. As you know, across the country, a lot of school systems have decided not to open. And here in our areas, I guess we've put off opening technically for 9 weeks, I think, so the first quarter. Will our public schools open during the year? I won't predict, but I will say that the criteria that they may be looking at, whether to open, they're not going to be any different in 9 weeks. And so that probably is a pretty good predictor of what's going to happen. Also, there's a lot about school openings, and this is a very emotional topic for a lot of people. It's probably the #1 discussed topics in the neighborhood meeting while jogging thing. There's a lot of things for a school system to think about, and the logistics are very difficult. And so there's also a fear factor amongst their teachers. Now, how much of that fear is real versus just perceived? We don't, I mean, real, probably not real high, but there's still some unknowns, as I just mentioned. So perceived fear, though, to a person is just as real fear, if that makes sense. And so that, I think, had a lot amount to play to it. Busing is difficult, and kids with special needs are hard, and laws say you have to take care of everyone the same way. So what's going to happen? Well, I think as most people who have children have been scrambling to find out, you got some options. You can do virtual learning at home or online learning at home and do it yourself, but a lot of families have two caregivers who both work, or you're a single caregiver and you work. So what do? So what's happening is that basically any church with a basement, a lot of neighborhoods have gotten together put together co-ops, or they're hiring people to come into their homes to do this. Usually it means bringing together several children together in one place because it decreases the costs and it makes the co-op easier. You only have to take one day off out of the week from work rather than every day off. I'm going to say just a couple things about that that people need to think about if you're doing that. One is that the one thing that we know in public health, that if you want to spread infection in children, close the schools or the daycare centers. And why is that? Is because it's like squishing that blob of whatever on the table. All those little pieces go out all over the place. And it's a lot harder to control and investigate, do contact tracing, and test in that situation. So if you're in a school and there's 20 kids in the class and there's one kid who has COVID in there, you can go in and identify the close contacts, quarantine them, and then isolate the individual. You don't have to shut down the whole school. You don't have to shut down the whole classroom, actually. We do this all the time with other communicable diseases like whooping cough. But when it's out there and you have no idea where kids are and getting their learning, it's a lot harder to do that. And so we're moving from kind of a controlled environment for providing schooling to one that's unregulated and uncontrolled. The other thing I want to say about it is that if you're doing this, get on the CDC website and look at their suggestions and guidelines for schools and how to do it, because you should be doing the exact same thing in your home or in your church basement or your community center or wherever you're trying to provide education for kids, be it online or in person or however you're doing it. Get on the website and look at the CDC guidelines, because they pertain to you in that environment just as much as they would to a large school system. So that means that even though you're doing it in a home and there's only 8 kids, and yeah, they all know each other because they've played together before and they're all friends or whatever, they need to mask, they need to personally distance, you have to be doing the disinfection regularly and the other things that are suggested on the website. Otherwise, we're talking about like being a beach house cluster, right? And that's not what we want to do. So just something to think about as you're moving forward with doing your online learning and group learning settings. Lastly, universities. Right now, universities are talking a lot about what to do this fall. I think I'd just summarize it by saying early on, a lot of universities were gung-ho and ready to go and were ready to try to open things up in fall. I think right now they're starting to see the realities a little bit more. Numbers haven't gone down. The logistics of how to do it is hard. Testing turnaround time is so long that if you are trying to test, isolate, and quarantine in settings of dormitories, the testing turnaround time is just so long you can't do it. I mean, the test result might come back and then it'll be time to release their isolation anyway. So it's looking hard. So I think in the next couple of weeks we'll be seeing statements. I know that Clemson's already put out that they're going to delay. University of Georgia's been having troubles. A lot of cases down there in Athens. And a lot of places are deciding not to bring everyone back, maybe just the grad students or stuff. So we'll see how the North Carolina schools weigh in on this. I think we'll be hearing about it in the next couple of weeks. Football is for fall. I don't know. I've talked about that before. We'll see. High school athletics, I don't think it's going to happen this fall. They haven't announced that, but I think if the schools aren't open, how are you going to have a football team, right? So anyway, that's what I have on my prepared remarks. So any questions people want to bring up?
I've got a couple. Talking about sports, since it's Major League Baseball's opening day, how realistic is it for the league to operate safely and complete the season when they can't play in a bubble like the NBA or the NHL?
Yeah, so Major League Baseball, opening day in July. Isn't that crazy? How realistic is it to complete a season? Well, it depends how tolerant they are to have some cases on their teams and what that might mean to them. So let's say, the team itself can bubbleize itself, one team. But when you're getting together with other teams and then you're traveling and players might be socializing some and there's a chance they could get exposed, and then if they get infected, they might infect other people on their team. So it may not affect the entire team, but maybe your pitching staff. So if 3/4 of your pitching staff are in quarantine, how does that mean for you be able to play games? So we'll have to see how it all goes. If they're fairly tolerant of people having infections occur periodically from time to time, and they're able to deal with it and work around it, then maybe we'll get a season that'll just be weird. But they'll have to be ready to accept that some infections might occur on their teams.
And sticking with the sports, the NBA recently had 0 coronavirus cases after testing everyone in their bubble. What do you think they're doing well, and is it sustainable in the long term?
Yeah. So the NBA in its bubble, right down in Orlando, right? Yeah. So I mean, that's where they're doing it at Disney. And boy, that better be a pretty strong and robust bubble, because Orlando area has got a lot of cases going on now. Their test positivity is like 15% or so in Orlando area. So there's a lot of people getting it. If your bubble is strong and resolute, you probably will get through it okay. It's the problem is when you have somebody, look kind of both ways, and it's like, hey, let's go out and have a couple beers and get dinner, and they leave the bubble, and then they come back to the bubble. Then the bubble's now been broken for a while, and exposures can occur. So if they can keep their discipline, I think they can maybe pull it off. But it's going to require some discipline.
There's been a lot of sort of like a change in tone at the national level and more tense at the local level. What is the messaging that experts like you are putting out there? Because something just doesn't seem to be connecting. Because in the north, where it's more densely populated, we're seeing a change in trends, but in the southern part, where it's sparsely populated, we're seeing a trending upward.
Yeah. So what's going on with the geographic differences? Why is the South getting nailed, and why is the Northeast okay? Well, most of the states, particularly the heavily affected ones in the South, are opened early. We pushed down the curve some during shelter at home, and then all of a sudden we let go in these states. And it doesn't take much to figure out that if you push it down, but you don't completely push it down, and then all of a sudden you let go of it, it's going to spring up, and it's going to spring up high. And it's like pushing down on the trampoline. The other thing that in some of the southern states has to do with essential industries and agriculture, so meatpacking, agriculture in areas where people have had to continue to work, and it's where it's socially, economically disadvantaged people who do that. And I think that's contributed to it some in some of the southern states also. Some people say, wow, it's been so hot in the South and so more people are spending indoors. I don't know. I don't have any way to study or measure that. The Northeast got nailed, and they got nailed early, and they were like, whoa, we don't like this, okay? Their hospitals were full, and people were watching the mortuary trucks parked outside of hospitals, and so many people were getting infected that they're taking this seriously. And they also stayed closed for a lot longer. I mean, it took them longer to get their numbers down, and then they stayed basically, in shelter in place for a while after that. I mean, it's just been in the last 2 weeks that New York City's even started to open some of their restaurants, and I think I think they were a little shell shocked earlier on and have been more careful about it all. People are more likely to wear their mask. Adherence rates there are higher. Personal distancing adherence is higher there. So I think that has something to do with it.
And just to follow up on that, what should we here in the South be doing in terms of the leadership direction? I know North Carolina has extended phase 2, but there's a lot of talk about we might be heading into maybe a second phase of a lockdown. I mean, give us some sense of
what so what should we be doing here in North Carolina? Well, so are you a half empty person or a half full person? And if you're a glass is half full person, you'd say, well, we really haven't had an explosive number of cases. Our hospitals are busy, and it's not all just from COVID, by the way. Our hospitals are busy for a lot of reasons. One is there's a backlog of people with illness, and the other is staffing, So we've been doing okay. So what could we do to actually start seeing those numbers decline in a meaningful way? One is pay attention to personal distancing. And it's not just about it at the grocery store. It's about how you do it with your family clusters. If someone decides to have a wedding, is that really good an idea? And then if you do it, keep the numbers down, wear your mask, personally distant while you're there. In your own family gatherings, unless it's your own household, we live together all the time, that's your bubble, okay? But if you're thinking about bringing other people in, pay attention to those things. Hey, I want to have a backyard barbecue and invite, 3 other couples over or families over and do it. Do it outside, personally distanced. Even though it feels bizarre in that setting to wear a mask, wear a mask. If you're doing it outside and you can really personally distance, maybe the mask isn't as important. But certainly if you got a thunderstorm and you're all coming indoors, you got to put the masks on. So that's one thing I think could do it. I mean, we have to, as a group, pay attention to what we know works. And, I think masking adherence is going up. Some of it's because work, the stores and such are just demanding it. And the other, it's kind of like seat belts. It takes a while for people to get kind of used to it. and then the mask feels, rather than feeling more like an annoyance, it feels more like a safety net for you. And people start thinking, hey, I want to be polite. Other people are worried. I'll wear my mask. So I think it's getting better, and we'll see. But those are the things that we need to be doing right now if we want to see our numbers going down in North Carolina. Because if they explode and we end up like Florida or Texas, then yeah, there's going to be people talking about going back to shelter in place. Nobody wants that. I bet you there's no one in this room. If I'd say, hey, shall we shelter in place? I bet I won't see a lot of raised hands. So let's try to do it the other way. And that's my big message, yeah.
I don't know the plan of all of the school districts, but I do know at least Mount Airy City Schools have announced they're going to be doing face-to-face instruction this semester. Can you speak a little bit to teachers and parents doing back-to-school stuff? Any advice you give specifically in the school setting?
Yeah, well, we talked a little bit about the school setting earlier. Mount Airy's deciding to go face-to-face. I mean, some of the smaller school systems, the logistics aren't as difficult. But the other thing is, I mean, this is probably the best thing that's ever happened for private schools. And so a lot of private schools are going to open. So figure out a way to keep your numbers down. Make sure there's personally distanced. Masking, I think, is a good idea, although a little bit controversial for kids, but I think it's a good idea. And then get on the CDC website and look at their recommendations. I think they're solid and good guidelines. I don't think they're overreaching. I don't think they're underreaching. Anything else?
Let's dwell on the private schools for a second here. A lot of people are, like you mentioned about the pods, and we're seeing some trends where people are pulling their kids out of public schools and going to the private schools as an option. Are we going to see, or is there a threat of seeing that cluster being a new point for the infections in kids? Is that sort of like the concern that you experts?
Yeah. So we talked about that some earlier, so I'll go back and hit the highlights of that. So when you bring the kids out and you disseminate them to other areas, one is the private schools, the large private schools that have been in place for a while, either faith-based or public-based or secular. They've been doing this for a while. They tend to be a little better resourced. They tend to be smaller. In their numbers, and they have some things. I mean, a lot of them, if they have busing, it's not essential like it is for some of the public schools, and so the logistics are easier for them, and a lot of them have been working on this over the summer. The ones that I worry about are more sort of the pop-up pods of co-instruction, using the Forsyth County or Guilford County's online learning systems, but doing it in a co-op or a pod, and that's done. I mean, for the child care reasons mostly, because people have to work and or do other things, and those are the ones, to tell you the truth, I worry about more, particularly as I've been going through the summer and hearing again and again about the beach house getaway cluster, or the wedding cluster, or the backyard barbecue cluster. These pods could be a cluster unless people pay attention to what they're doing in them. And just because you got 6 kids, 7 kids, and you're doing it in a home, doesn't mean you don't have to be paying attention to all these other things, and you need to. So.
Now, looking ahead to some optimism, there's a lot of talk about vaccine. Is there anything that you can share with us about that conversation?
Yeah, we are optimistic about the vaccine. A lot of us in infectious diseases put the word cautiously before we use the word optimism. That just comes from a long decades of experience. But yeah, we're cautiously optimistic about vaccine. There's still some open questions about, how long immunity lasts, how strong it'll be, how many shots we'll need. I think it'll be 2 to get it. And then as we talked about all the logistics about getting it out there. The other thing that there may be some therapeutics coming down the pike in the next year, and these might, if given early in the infection, particularly for outpatients, might prevent hospitalization and or severe complications. Because with most viral infections, you want to treat it early in the first 2 or 3 days. I mean, it's that way with Tamiflu. It really works in the first 2 days for flu. And so having an IV product that has to be given in the hospital makes that hard, right? It's hard to get it in the first 2 days. So you want a pill that can be given earlier. And then maybe these pills will help prevent it too. So if you have high-risk people in a household, let's say, college student comes home, he's got COVID, and he's staying with his parents and grandparents, then maybe you could give the pill to the older people and prevent it in them. So we'll have to see, but that's what we do with influenza, and with a little luck, maybe we can do it with COVID. Tony Fauci said the other day, and a lot of people put out a big sigh, saying, I don't think we're ever going to eradicate, COVID. I agree with that totally. I've been saying that all along. We're not going to eradicate it like we eradicated smallpox, or like we'll hopefully eradicate polio, or very, very few infectious diseases are actually eradicated. We came close with measles, but it came back. So we're going to end up basically trying to push it back into under the bed, and then and with some herd immunity, with some vaccination, we may need to get the shot every year, just like we do the flu shot. It's possible. Then it'll end up becoming more like how we deal with influenza. So there'll still be infections, there'll still be some deaths, but it won't be nearly what we're seeing now in the pandemic. All good questions. All right, I guess we'll hang it up. See you next week.